And the title of this session has a sort of a dual meaning. I'm going to talk to you about what's going on at the NMC, but what I hope that this session will demonstrate is that midwifery does matter at the NMC. We're nursing and midwifery, and as advisors, we work really hard to make sure that the midwifery voice is actually heard across the NMC, particularly where perhaps the focus has been more on nursing, but to think about midwifery and what it actually means. I think I've got to start with just giving you this update following that culture report that was published last July, which I'm sure many of you have seen. It makes very, very difficult reading. It also makes reading quite puzzling for those of us who work within professional practice, and this wasn't our experience. But we have to recognise that there are people working in the NMC that are not having a good experience and are experiencing behaviours which are not acceptable. And this was the apology we put out at the time. We're committed to this change programme. It will not be something that will be quick to resolve. It's going to have to be done over a period of time. And I want you to know that the midwifery team is absolutely committed to supporting this work. At this stage, I can't say what that work is, because this is still work that's really being looked at. And we now have a new interim Chief Executive and Registrar, Paul Rees. He comes with a lot of experience of being in organisations that are having to address culture. And he's also got a key role to improve NMC fitness to practice processes where we know that there are issues. But ultimately, he needs to be considering what this means for the public and, of course, the professionals on our register. So when you get the slides, do take a look at Paul Rees, introduce yourself, familiarise yourself to this new CEO, and he is committed to having a plan by next month. So he is working at pace to get things addressed. So next time I talk in one of the festivals, hopefully I'll have some update to give you. So here's the midwifery team. Verena and I are here today. We've been at the NMC 6 and 7 years respectively, and Tracy McCormack, who some of you might know, who was Director of Midwifery at King's, joined us last year. So there are midwives across the organisation, but if you like, we're the substantive team, and we're the ones that tend to be working across the organisation on a number of things. And we've sort of listed our experience at the top of that slide, and you can see we pretty well cover all bases, which is really helpful. But collectively, we've become a strong voice for midwifery within the NMC. We have a midwifery plan, and this was presented to council. And this sounds all very official, doesn't it, really? But I think this has been quite important, that we've laid out what we want to do as a team, because it makes council really realise what is actually happening in midwifery and what we need to do as the NMC for midwives. And that will be a live document that we can report back in. And we've not really had that mechanism. So although it sounds a little bit formal, it's quite important to get that, because that really raises the profile of midwifery in the eyes of council. And you can see the sort of work streams that we're involved in, thinking about workforce, unregulated people, education and quality assurance, multidisciplinary working, etc. And it's sort of quite broad brush if you look at those key work streams. So to give you some updates of what we've been particularly doing recently, is that we've had the standards of proficiency now. I was just going to say 7 years, but actually 6 years. 2019 they were published. So this is incredible. But I think we have to recognise we've obviously had the pandemic in the middle of this, and that inevitably made a difference as to how quickly those proficiencies got embedded. They certainly obviously got took on by the universities, so programmes had to be updated. So when I talk about the proficiencies, I'm talking about what they mean for you as midwives. So we'd developed a mapping document following the interim report of Ockenden and when Ockenden published, and we did exactly the same when Kirkup reported. And what we did is we mapped the standards of proficiency to the recommendations of those two key reports to say, what does this actually mean? And it's quite staggering. When you do an exercise like that, you can see the strength in our proficiencies that we've got, very much based on evidence. And I'll always remember our previous CEO, Andrea Sutcliffe, when she went to one of the government standing committees, she stood up and said that if midwives were practicing and aligning themselves exactly to those standards of proficiency, it means that they would be meeting those recommendations. Now, that's not to say that there aren't other things that need to be done, but I think it shows you that how important these standards are. So we'd circulated it round to the directors of midwifery in a sort of a more informal meeting type way. But last year we sort of revamped that document and recirculated it. And what we've asked for this time is we've asked directors of midwifery to go to their boards and say, this is where we are on this journey to meeting these standards. And that really should give strength to the directors in terms of what resources they might need, maybe change in how service is delivered to make sure they're meeting the standards. So that was sent out in July. We needed to give it a little bit of time because over the summer maybe boards were not meeting, and now we're currently evaluating it to see how far directors of midwifery have been able to benchmark themselves against the standards. And I'll give you an example. One of the questions is, do all your midwives understand the Lancet framework? Which of course is where the proficiencies are based on. I went somewhere recently and I got blank faces around the room, which slightly is worrying when you think that they're supporting student midwives. But it was a very simple question to see, well, actually, if they're not, what are they going to do about it in service? The other piece of work that we've been doing, particularly with talking around unregulated people, and when I talk about this very clunky term, what I mean by that is anybody who could be giving care in labour and birth or working with women who are not midwives. And as you all know, we have a protected function and we have a protected title in the UK, which was hard fought for, and we don't, this is what keeps women safe. But little by little, there has been people beginning to work in this space. In some instances, for very good reasons. Doulas give amazing care to women and support them, but they shouldn't be doing clinical care. They're there to support the psychological needs of the women. And what we realised when we looked at the programme standards post leaving Europe, we did a few we didn't change them, but we actually made the language more aligned to the proficiencies. And I sat on a group and we talked about this word conducting birth, that it didn't feel right, and we changed it to the word facilitate. But what we now realise is that Doulas UK actually also use that word. So although it doesn't mean that it's going to make any difference to you as practice supervisors in terms of what you're doing, we've strengthened that word to really align it with that protected function. So we talk about conducting births again, as opposed to facilitate. We also work with the midwifery workforce. Obviously, I've already spoken about adoption of the standards. We need to keep those standards under review as evidence emerges. And we also need to make sure that our test of competence, which are internationally educated midwives and midwives returning to practice will undertake to join the register. And we need to make sure that also is fit for purpose. And we do work with our stakeholders. When I talk about stakeholders, I'm thinking about the NHS, across the 4 countries, lead midwives, a whole range of people to work with them to support a whole range of initiatives. And that would include things like ethical recruitment, the fact that we've got a new EU directive. We don't have to abide by a new EU directive, of course, but we need to be mindful about what is actually happening to the EU and the rest of the world, as well as these, of course, midwifery reviews. Also done a lot of work with internationally educated midwives. They're an important workforce. And we have an outreach team called Employer Link Service who engages with your directors of midwifery and heads of midwifery. And they've been doing a lot of work with internationally educated midwives to welcome them to UK and for them to understand what the NMC is doing. And there's various research projects as well as test of competence activity that we want to continue to embrace them really as part of being on our register. Now, I've already mentioned the work we're doing on unregulated people. I don't particularly like that title, but it's the only way I can sort of capture these various titles that are being used. So, you know, you hear people using birth keeper, doulas, I think, you know, we understand. We've got other people talking about being a deregistered midwife, which is no such thing, actually. But we were hearing a lot of concern, I would say, from midwives about what they need to do, perhaps when women are wanting a free birth, wanting care outside of guidance. And it was like a collection of issues, as well as a collection of different people that were involved. So although it wasn't really our role to do this, we decided for protection of the public, which is absolutely our role, we needed to bring these key stakeholders together. So we've been working for about 18 months now with NHS across the 4 countries, the chief midwifery officers. We've brought on Doula UK, we've brought the ambulance service in, we've brought the police in to try to work through what these issues are and what it means for all of you if you are having to be faced with some of these issues. And what it's culminated in, and these we hope to soft launch at the RCM conference, is some personalised care principles, which will capture all of these sort of issues that we've been talking about. And at the moment they're structured in what the women can expect, what our role is as the NMC, what we expect the midwife to have, and what we expect trusts and health boards to do. And we hope that these principles will be useful, but I don't think they're going to be the answer to all the midwives' concerns, but it will certainly go some way for trusts and health boards to see what they need to do next. But it's been a very much a co-produced, collaborative piece of work, which is really important because there's so many different people involved. I also want to say a little bit about advanced practice, because midwifery really set themselves outside of this about 10 years ago, but now we're absolutely firmly in this space. And it's been a piece of work that's been ongoing for some time, recognising that there isn't even an agreed definition of AP, particularly in midwifery. We found that there's a variation in roles of what people call themselves, and we needed to really get some clarity on this if we needed to be involved in this space, because if you like, it's been a sort of something that's sort of developed. The decision now is that we will be regulating advanced practitioners, but in order to do that, we're going to have to develop standards of proficiency for advanced level practice. We need to think about what this means across the UK, because obviously people are at different stages, and we need to think what it's going to mean for revalidation, because that's the way it will account for. I think the Royal College of Midwives statement has been very helpful. This is a clarity really about what is understood about advanced practice in midwifery, meaning that it's not a mini doctor's role, this is an advanced midwife. And I think that's been quite helpful. So again, that work is ongoing. There's ways of signing up, if any of you are in advanced practice or you've got an interest in it, to join that community of interest, because ultimately those standards will have to go out for public consultation. And although we've not got a precise timeline, those work streams have sort of begun in the autumn last year, and we hope to continue with that work. And when you get the slides, you can see that you can go straight to the website and join the community of interest to get up to date, because it is important that we know what we are going to be what this is going to be doing, which might look a little bit different from nursing. The other thing which is really important to you is this practice learning review. And we've done some exploratory work over the last few months, and we were hearing a lot of concerns about practice supervision, the SSA standards. We were hearing a number of concerns about student experiences. We were worried about attrition and all these sort of things, and felt we needed to do some more work in it. And again, do sign up to this community interest, because I'm sure you're all practice supervisors in this room and this could have an impact for you. So I'm not going to go through this because you can read it at length, but we did a very thorough piece of work through Nuffield and Florence Nightingale Trust, and it was a 6-month study looking at the effectiveness of nursing and midwifery practice learning across the UK. And that piece of work has now culminated, and we went to council at the end of January, and now we have these 5 key lines of inquiry that we're going to actually do next. So the first thing is we want to look at students with protected characteristics, and also the importance of reasonable adjustments and what this actually means for their practice learning. We also want to understand SSA a bit more. We may strengthen those standards. Now, I don't want you to go away and say, oh, the NMC is doing this. This is all up for discussion. We need to get the input from all of you who are involved in this to see where we need to go next. But we recognise that SSA is not perhaps quite working as we intended, and what would we need to do? And it could mean that we strengthen those standards. We want to look at some quality indicators, a part of our quality assurance function of programmes. And I think number 4 is really important. And I think it's important that we've made no decision whatsoever at the moment. We want to evaluate some key aspects of the midwifery curriculum. We want to understand midwifery student practice learning experiences specifically, and we want to do that to see how that supports them attaining proficiency. And that could include looking at number of births and types of births. And I'm going to give myself a plug, Sue, that please tune into the Midwifery Hour in March, because I want to look at that key line of inquiry specifically, because I think we've got some really important decisions to make, because there are folk that want to have a very different approach, which could be the right way, but what do we replace it with? And do we want to be misaligned with the EU and the rest of the world, who also do this? So I think we've got some really careful decisions to make, and we must hear the voices of practice supervision, because obviously you're the ones who sign off that proficiency to ultimately put them on the register. And we will be doing something similar for nursing curricula as well, about how they attain proficiencies. So I think the message to go away with, besides tuning into the Midwifery Hour in March, on March the 12th, is that we've not decided to do anything at the moment. We might not do anything. We might strengthen some aspects, but we've got to build this consensus, because there are some louder voices and other voices who want things, and we've got to know that it's right for midwifery. And within that, that could be thinking about simulation to replace some practice hours. But nothing has been decided as yet. So I think I'll pause there for some comments and questions, or challenges even.